Every year on July 28th, we observe World Hepatitis Day. This day serves as a critical reminder of the global burden of viral hepatitis. It's a call to action for increased awareness, prevention, and treatment efforts. Millions of people worldwide live with this disease, often unaware of its presence. We must work together to combat this silent epidemic. Hepatitis can have severe consequences if left undiagnosed and untreated. Liver damage, cirrhosis, and even liver cancer are potential risks. World Hepatitis Day provides a platform to educate ourselves and others about this disease. We can all contribute to a future free from viral hepatitis. Let's delve deeper into understanding this disease and how we can make a difference.
Hepatitis refers to inflammation of the liver, a vital organ responsible for numerous bodily functions. It can disrupt digestion, metabolism, and blood clotting. While various factors can cause hepatitis, viral infections are among the most common culprits. There are 5 main types of viral hepatitis: A, B, C, D, and E. Each type has a different mode of transmission and can cause a range of symptoms. Some individuals may experience mild, flu-like symptoms, while others may develop severe liver damage. Hepatitis often progresses silently, with many individuals unaware they are infected. This silent progression makes it crucial to understand the different types, their causes, and the importance of early detection. Hepatitis A and E typically spread through contaminated food and water. This often occurs in areas with poor sanitation. These types of hepatitis are usually acute infections, meaning they last for a short period. Hepatitis B, C, and D spread through contact with infected blood and bodily fluids. Sharing needles, unsafe medical practices, and mother-to-child transmission during childbirth are common modes of transmission. These types can lead to chronic infections, lasting for years or even a lifetime. Understanding the different causes of hepatitis is crucial for effective prevention. By adopting safe hygiene practices, getting vaccinated, and practicing safe sex, we can significantly reduce the risk of infection. Hepatitis often doesn't present noticeable symptoms in its early stages. This makes regular testing crucial, especially for those at higher risk. However, as the disease progresses, some common signs and symptoms may appear. Fatigue, loss of appetite, nausea, vomiting, abdominal pain, and yellowing of the skin and eyes, known as jaundice, are potential indicators. Dark urine, pale stools, and joint pain can also occur. It's important to note that these symptoms are not exclusive to hepatitis and can indicate other health conditions. If you experience any of these symptoms, it's essential to seek medical attention for a proper diagnosis. Early detection is key to effective treatment and preventing further liver damage. Chapter Section 5. Navigating treatment, a path to recovery. Treatment options for hepatitis vary depending on the type of virus, the severity of the infection, and the individual's overall health. Antiviral medications are the cornerstone of treatment for chronic hepatitis B and C. These medications can suppress viral replication, slowing down liver damage and reducing the risk of complications. In some cases, a liver transplant may be necessary for individuals with severe liver damage. This involves replacing the damaged liver with a healthy one from a donor. Beyond medications and procedures, lifestyle modifications play a vital role in managing hepatitis and supporting liver health. Maintaining a healthy weight, eating a balanced diet, avoiding alcohol consumption, and quitting smoking are essential steps towards recovery.
Section 6. Living with hepatitis, management and support. Living with hepatitis, whether chronic or acute, can be challenging. It requires ongoing medical care, lifestyle adjustments, and emotional support. Regular monitoring of liver function through blood tests and imaging scans is essential to track the disease's progression and adjust treatment plans as needed. Support groups and mental health professionals can provide invaluable emotional support, helping individuals cope with the diagnosis and navigate the challenges of living with a chronic illness. Open communication with family and friends is also crucial. Sharing your diagnosis can create a network of support and understanding. Remember, you are not alone in this journey. Numerous resources are available to provide guidance, information, and support for individuals living with hepatitis.
Section 7. Prevention is key, safeguarding yourself and others. Preventing hepatitis is far more effective than treating its consequences. Thankfully, there are several measures we can take to protect ourselves and others from this potentially devastating disease. Vaccination is a powerful tool against hepatitis A and B. These vaccines are safe, effective, and readily available. Practicing good hygiene, such as frequent hand washing, especially before handling food and after using the restroom, is crucial in preventing the spread of hepatitis A and E. Safe sex practices, including using condoms consistently, can reduce the risk of transmission for hepatitis B and C. Avoiding sharing needles is paramount in preventing these infections. If you require medical or dental procedures, ensure that sterile equipment is used.
Section 8. Real life, real stories, triumph over hepatitis. Let's meet Sarah, a young woman diagnosed with hepatitis C after a routine blood test. Despite the initial shock and fear, Sarah embraced her diagnosis with courage and determination. With the support of her healthcare team and loved ones, she adhered to her treatment plan, adopted a healthy lifestyle, and successfully cleared the virus. Sarah's story exemplifies the power of early detection, comprehensive care, and unwavering resilience in overcoming hepatitis.
Then there's David, who contracted hepatitis B during his youth. While he experienced periods of fatigue and discomfort, David refused to let the disease define him. He became an advocate for hepatitis awareness, sharing his story to educate others and combat stigma. David's journey highlights the importance of open conversations, breaking down barriers, and embracing life despite the challenges of a chronic illness.
These stories represent a fraction of the countless individuals who have faced hepatitis with strength and resilience. Their experiences remind us that with early detection, proper management, and unwavering support, we can overcome this disease and live full, healthy lives.
Section 9, the future of hepatitis, research and eradication efforts. The fight against hepatitis continues, with researchers and healthcare professionals working tirelessly towards a world free from this disease. Advancements in antiviral therapies have significantly improved treatment outcomes for chronic hepatitis B and C, bringing us closer to a cure. New drug discoveries are on the horizon, offering hope for shorter treatment durations, fewer side effects, and higher cure rates. Moreover, global eradication efforts are gaining momentum, with organizations like the World Health Organization leading the charge. These efforts focus on expanding access to vaccination, improving disease surveillance, and implementing effective prevention programs worldwide. While challenges remain, the future of hepatitis looks promising. With continued research, public health interventions, and global collaboration, we can strive for a world where hepatitis is a disease of the past.
Section 10. A call to action. Your role in the fight against hepatitis world. Hepatitis Day is not merely a day of awareness. It's a call to action for everyone to play their part in the fight against this global health threat. We can all contribute to the fight against hepatitis, regardless of our backgrounds or professions. Educate yourself and others about hepatitis, its causes, symptoms, and prevention strategies. Engage in open conversations with your family and friends, dispelling myths and reducing stigma surrounding the disease. Support organizations dedicated to hepatitis research, prevention, and treatment by volunteering your time or making donations. Encourage your local communities and governments to prioritize hepatitis prevention programs and increase access to testing and treatment services.
Section 11. Together we can conquer hepatitis. Hepatitis is a global health challenge, but it's a challenge we can overcome together. By understanding the disease, embracing prevention strategies, and supporting those affected, we can create a world free from the burden of viral hepatitis. Let's use World Hepatitis Day as a springboard for action. Let's amplify our voices, raise awareness, and work hand in hand to create a healthier future for all. Remember, it's within our power to rewrite the narrative surrounding hepatitis and ensure that future generations inherit a world where this silent epidemic is nothing but a distant memory.